Welcome to our podcast. This is another recorded episode of Stay Classy San Diego, sponsored by MaxLux Media at maxluxmedia.com and Barntime Productions at barntimemusic.com, with your host being myself, Steve Wire, a freelance reporter. This podcast is dedicated to healthy dialogue around all things local policy in the North County San Diego area. Join us weekly as we interview political leaders, analysts, professionals, and community members on issues ranging from homelessness to housing density to elections.
All right. So in today's episode, we're going to be talking about some of the homelessness advocacy that's going on in North County. Today on my left here, we have Linda Mimms, who is the vice chair of the Schizophrenia and Psychosis Action Alliance, which is a national organization dedicated to standing for hope and recovery through the promotion of education, peer-based support programs, and better public policy, advocating for research, development, and general change. She has her master's in public policy from Duke University. Thanks for coming on today, Linda.
Thank you, Steve.
On the right here, we have Chris Megison. Chris is the president and CEO and co-founder of Solutions for Change. Chris is a social entrepreneur. And the Solutions for Change nonprofit is dedicated to ending homelessness throughout San Diego County. Chris is also a former Marine, and thank you so much for coming onto the program. We've spoken before for various stories that I've written in the Coast News, and always appreciate talking to you, Chris, so thank you.
Good to be here, Steve. Thanks.
Great. So I want to get right into the issue. So we had some numbers come out earlier this year, the point in time count, which I'm sure you both had a chance to look at, which shows that countywide homelessness is up about 10% since 2020. That's the official estimate. Locally in Encinitas, where we're recording right now, homelessness is up about 74% since 2020. And I just want to talk to you both kind of broadly about sort of like what's behind this, like clearly something isn't working in the approach that we're taking at a countywide, at a local level, at a municipal level. So what's behind the rise since 2020, and what isn't working about our current approach as a county, and again on that local level? Chris, you want to start?
Yeah, sure. Thanks. It's been 3 decades since I started doing this work, so I have seen this problem kind of ebb and flow, but I would say within the last 3 to 5 years, it has accelerated dramatically. And as you just pointed out, Steve, the numbers here are increasing. And why is it that Encinitas all of a sudden has seen this huge spike in homelessness? And so from my perspective, and this is, literally thousands of individuals that I've connected with throughout this time that have been homeless for various different reasons, tens of thousands of interactions with the homeless, and as many, if not more, with people that are in our community about homelessness. From my perspective and from our team's perspective, this really comes down to a design fault. So there is a fundamental design fault within the state's approach to homelessness. And essentially, the way we describe it is, look, people come with different issues. They come with mental health issues. They come with behavioral issues. They come with economic displacement issues. You have to have an approach that is directly commensurate with that cause, with those 3 different areas that I just pointed out. And what the state has said is there's one approach, and it's only one, and it's housing, and that's it. And so I think that, everybody can agree that housing is needed to solve homelessness, but there's a lot of other methods and strategies that go into how you engage people. And so if you have only one approach, if it's only a one-size-fits-all approach, you're going to miss on a lot of other needs that are unmet that Linda and I and others see. And I believe that because of that fundamental design flaw, we are seeing a rapid increase. And I will also say, too, that our society today, there is a lot of escapism. There's a lot of stress out there. There's a lot of challenges out there, and people are escaping more, and the access to escapism behaviors is. I'm a behavioralist. I've lived it and worked in it, and we're seeing record numbers of people with ease of access to escape. You can click, your phone, and in 30 minutes, somebody shows up with some really, really good marijuana right to your door. Right? You didn't have that just a few years ago. So that's just one of many different ways that people can escape. And what happens is when people don't deal well with reality, they fall out. And we're seeing record numbers of fallout.
Sure. Linda, I want to turn to you. Do you sort of agree or disagree with Chris that the sort of state housing first approach hasn't been successful, and that we're seeing that borne out at the county level in the numbers, and also like in cities like Encinitas where the numbers are skyrocketing? I mean, do What would you say about that?
Well, I would say that for the approximately 2,500 homeless people that have mental illness, based on a 30% figure that is from our government, the SAMHSA, which is the Substance Abuse and Mental Health Services Administration, that no, we're not addressing those people's needs. And to add on to what Chris just said, we not only need a supportive housing with clinical services and also therapeutic services for these people that are suffering from brain diseases. Schizophrenia and psychosis, other psychosis conditions are brain diseases. They are medical diseases. They are not behavioral and they are not mental. They are of the brain, the organ. And we are not treating people that are very, very ill in psychosis with medical methods or in the general healthcare system. We have carved them out. And so in conjunction with the housing first principle, they are not really looking at this population. And this population are our sickest human beings that are on the streets suffering, with families who are suffering and trying to get them help. They need hospital beds, inpatient care. It's not a dirty word. Inpatient care is not carceral. It is meant for recovery and healing. And we're not seeing enough of that. Therefore, we've got multiple issues, not just the housing issue. We have the treatment of the disease. These are treatable diseases that have not been viewed that way in the whole United States and in our community.
Sure. Chris, unless you had anything you want to say, I was going to ask, so the numbers I've looked at, it's basically between 30 and 50% conservatively of homeless persons nationwide suffer either from and or mental illness and drug addiction. And so I want both of you to sort of talk listeners through, how do these conditions exacerbate homelessness, and how does that relate back to the argument that we're kind of hearing from people on the state side saying that this is purely an issue of affordable housing? How is that notion incorrect, and how do these more fundamental factors play a role in exacerbating homelessness? Chris?
Yeah, I think again it is a catastrophic event and series of events that we're seeing because we are not addressing the root, what causes homelessness. Homelessness. And I think we see all this as providers, people that are in this work. Homelessness is a consequence of, and now insert whether it is a severe mental illness, whether it is a chronic substance abuse problem, whether it is multi-generational poverty, trauma, what have you. And so the miss is catastrophic. One of the first things that my coach said when I got into this work, and I was complaining about things, and he goes, look, every business, every company, every nonprofit, or every public agency is perfectly designed to get the results that you're getting. So if you don't like the results, Megison, you're the chief executive, you better figure it out because it's on you. You're the guy. It's your nonprofit, right? And I was like, oh man, I hate that when I get, smacked between the eye. I was like, but he was right. So that is the exact problem that is occurring. People are showing up with very serious issues. And our government is saying, hey, go behind this door. Now, what we see is you get behind the door, you're technically no longer homeless, but you are suffering and dying behind those doors. And as a veteran, and I hear all this virtue signaling stuff about how we're reducing veteran homeless or homelessness, people are dying and overdosing behind those doors. Unacceptable, should not happen. These are human beings. And they're putting them behind a door and saying, problem solved. Well, you know what's solved? Out of sight, out of mind, and that's it. And that is why we are in a serious, catastrophic dilemma right here. We are now fully aligned right behind the Bay Area and LA in terms of strategy and tactics. In another 2 or 3 years, it will be right here in Encinitas and right here in San Diego County. You think it's bad now? Wait 2 or 3 more years as we follow the design failures of the Bay Area and LA. And this will be a place where people are either going to be, that's it, I'm out of here, I'm leaving, or there's going to be worse. There's going to be a lot of deaths on the street, just like there is up there. I mean, there is a lot of human tragedy. And here's the other thing, Steve. Our humanity is being completely diminished, right? When is enough enough? When is enough for the people of Encinitas, the people of San Diego County, where we're going to stand up and say, that's it, right? We're not doing this anymore. The only way it's going to change is we got to vote these people out and vote people in. I don't care what side of the aisle. It's not political. It's people that are going to get in there and make the legislative changes needed in order for this problem here to get solved at the root cause instead of just throwing people behind a door.
Sure. Linda, any comments there?
I actually really agree with Chris, and I will say that as far as people that are suffering from schizophrenia and other psychosis-related disorders, these people are not being treated like they have a medical brain disease. For instance, if you have a cardiac event at home and you call an ambulance, it rushes over, it rushes you to the hospital, you get a doctor who diagnoses you quickly and starts performing life-saving care. When you're released, you have a plan, you get cardiac rehab, etc. When you have a brain attack or acute psychosis, the police are called, they handcuff you, they throw you in the back of their squad car, and they take you either to an ER, which can't really treat you, or a jail cell. And at the ER, they will just sedate you and put you back on the street. That isn't the type of medical care these people need. These are chronic, lifelong illnesses. We are not treating them like that. We have put them in a separate and unequal system, the behavioral healthcare system, which is misnamed anyway, behavioral healthcare system, instead of in the general medical healthcare system. So it's systematic negligence. Mm-hmm. It's actually extending the time from when a person can get the care they need to stop brain-damaging psychosis. The longer you are in untreated psychosis, the more gray matter you lose. You are condemning people to more disability and maybe never being able to live independently again or contribute to society. So that's malpractice. As far as I'm concerned, we're practicing malpractice statewide, and this is a huge part. This is a part of the population that costs our communities the most money because we're allowing them to cycle through ER, jail cells, back on the streets. It's just an endless cycle. And it's not helping people. These are human beings. They have treatable diseases that we are neglecting to treat. And I agree with Chris, we're pushing them off. And even our own county government doesn't get it. They don't get it. They have a new plan out, and they are proposing reducing inpatient hospital beds by 40% with
Really?
the logic that if they treat people upstream, they can prevent any kind of hospitalization, right? You cannot prevent a serious brain illness, a serious brain disorder. You can't prevent that. Now, what you can do is catch it early, treat it, and let people start going into recovery, and then get them out of that cycle, which is it's, as Chris said, it's not only costing us money, bucks, which all politicians look at and governments, it's costing us our humanity. Are we willing to keep watching these people die with their rights on our streets? It's just not right.
I want to get into that in a few minutes, just in terms of the sort of conversation about personal liberty versus livelihood and that sort of thing. But I wanted to address a term, Linda, that's come up during a lot of my interviews with you, where we've talked about this concept of anosognosia. Do you want to explain to people what anosognosia means and what role it plays in keeping people from getting help?
Gladly.
Yeah.
Anosognosia is the inability to recognize that you are sick. This is a symptom of 56 to 98% of people who have a psychotic disorder, schizophrenia, bipolar with mania, severe depression. This is the number one reason people do not get care voluntarily. They don't recognize they're sick. Why should they? If I looked at you and said, "Hey, Chris, you're having a cardiac event and you feel fine," you're not going to believe me, right? You wouldn't go get care. So These people, it's not denial. And when you see somebody on the street that's acting out, I want everybody that's listening to this podcast to understand these people are not in denial. They are unable to get care for themselves. It's like if you have a toddler. As a parent, you take care of your toddler. You take your toddler in to get their vaccinations, to get health care when they're sick. When they turn 18, families, parents have no power to get their loved one into care because it turns over to the laws that protect civil rights over a person's right to get the health care they need and deserve to be healthy. So anosognosia is a huge issue, and it's not even recognized in our systems by many psychiatrists, doctors, and clinicians that are taking care of these people. And therefore, there's a lot of mistreatment in, shake yourself up. Get up by your bootstraps. I've seen so many letters to the editor the past month where there's these people that are saying, don't give them sleeping bags in freezing weather. Don't give the veterans sleeping bags. That's wrong. And then the person that responded said, we've offered to take them to shelters. They don't want to go to the shelters. So are we going to make the choice not to help these people? And they can't get up by their bootstraps, and they will not hit rock bottom with a serious brain disease, serious mental illness. Rock bottom is death.
Sure.
So
I want to talk about the ongoing public dialogue over conservatorships. So, Chris, this question is for you. I guess we've kind of run into this wall in some of my previous podcast episodes of the discussion around, you can offer people services, you can offer people help, but you can't make them accept it to a certain extent. And the notion of conservatorships as a means of involuntary treatment and of getting people who maybe are incapable of recognizing that they need help, getting those people into treatment, is that the kind of notion that you subscribe to? Do you just support expanding access to conservatorships, and why or why not?
So this has been a real big topic amongst in our field over the last several months or so. I think it has to be used very intentionally and very strategically, and frankly very sparingly. My concern is that I believe that a lot of these government policies and the legislation help to create the problem, and now the government is coming in and saying, "Wow, look at this is so bad." Well, yeah, the policies, and frankly the laws that have been passed created the conditions by which this problem has become unbearable for all of us, especially the ones that are on the street, as Linda was just talking about. And so now you want to come in and say, now let's go ahead and lock you up against your will. Well, that should be used very intentionally, very strategically, and very sparingly, because I believe that most of the folks with another type of intervention, which we can talk about if you want, can respond and will respond. And I believe in that regard, it isn't about the government coming in. And the other thing, just quickly, is like, anybody out there here seeing any government policies help heal broken lives? Anybody? Like I get it, right? We need these policies, but wow, like the strategies, the laws that we've all seen here come top down, they haven't worked. And so I'm against, as I mentioned to you, I'm just against more government intervention. I think there should be less. And I do believe that what the government can do is create spaces for folks like Linda and I and others to operate in such a way where it doesn't obstruct, where it doesn't impede, and where we can get in there with the strategies that we need. And it's people helping people, and it's communities helping communities, and it's really that approach, I think, with the right smart medical models and the right smart things that we know that can work. That's what has to happen, and much less of the Linda mentioned the county. I mean, my goodness, the county's budget, their mental health budget has quadrupled over the last few years. Why aren't we seeing a major decrease? Ask ourselves that. There's something that isn't right.
Sure. And just by the way, for listeners or viewers who might not be aware, like when we're talking about conservatorships here, we're talking about actually a person who is an adult being essentially ordered into involuntary care or treatment, usually under the supervision of a guardian or a parent or some sort of adult figure in their life. And so that's sort of where the controversy comes in, right? Because it's this notion of at what point are we unduly infringing upon this person's civil liberties, but also the argument being made on the other side as well. Somebody with severe schizophrenia or schizoaffective disorder, or even in some cases bipolar, sometimes somebody with those like brain conditions, like they're not even capable of making those choices for themselves. And so at what point do we step in and say that this person, out of human dignity and that sort of thing, has a right to treatment for themselves beyond whether they consent to it or not? So I want to go to you, Linda, and get your opinion on this issue. Are you in favor of expanding access to conservatorships in California? Like can you also sort of explain to people who aren't familiar with this field, like what is the current state of our conservatorship laws? Like there's the conversation around LPS, like can you sort of explain what that is and what you support amending or otherwise?
Well, I'll start out with the LPS Act, Lanterman-Petrus Short Act, which was enacted in 1967, over a half century ago. And the purpose of that act was to release people from the old asylums, which nobody wants to ever come back. I just want to throw that out there because I'm going to say some things that, are controversial. But that act was aimed at emptying out the asylums so people could come back into the community and get community care. But what happened was the community care didn't materialize. So what happened was that if you had a chart and you looked at, I don't know, what do you call those charts? Not a pie chart, just a axis chart. It shows in the early 70s that when the people came out of the asylums, down like this, then the jail population went up like this, as did the homeless population. That should have told them right there and then, just a few years out, that this was not helping the people get back into recovery. Also, the other point I want to make here is what recovery looks like for people that have a chronic brain disease. They need people, place, and purpose. So those old asylums, they did have shelter, they did have clothing, and they had purpose because they gave people jobs. And that is something that was lacking when they just dumped these people out on the streets with no adequate community care. So this is a point that has kind of taken off. When LPS was enacted, it's before we had scientific and medical evidence on the best treatment paradigms for people, and where we found out that, yes, these are treatable brain diseases, and they need medical attention. So we've known that for like 50 years, and nothing has been done along those lines. So LPS put up huge barriers for people to get into compassionate care. Now, I know a lot of the rhetoric is involuntary, coerced. I mean, that's what the ACLU and the disabilities rights groups, they always frame it like this.
It's a little more complicated than that, though.
It is more complicated than that. It's not a carceral situation. It's meant to be a recovery and healing place. And most of these people, when they're very sick, since they don't understand they're sick, they're going to walk out of a hospital unit that isn't locked. They're going to walk out of a crisis stabilization unit, which is, we're getting more of those in the county, and they're only good for 24 hours. And they're already not being treated correctly when they're taken in on a 5150 to a psychiatric hospital, because normally they just get spit back out and sedated. These illnesses take a long time to actually treat, to get the right medication. It's not complete science, it's partly an art, because we don't know enough about these illnesses to be able, we don't have biomarkers, we don't have genetic workups yet, we don't have those things. So it takes longer than a week or 2 weeks. So what are we going to do about that? This is a medical policy issue. Doctors should be making these decisions for their patients. It's not, and I understand what you're saying about government, but the way it's set up in our state, folks who have a family member that is very sick, they're actually being told by police officers and other agencies in the county that the best chance to get care for their child is to kick them out on the street, make them homeless, and then have them, eventually they're going to interface with police. Then they're spit into the criminal justice system. and they're not treated. All this time, they're untreated. They're losing their brain capacity. I mean, that's why I will say that conservatorship is like a last measure, and it's an LPS conservatorship. It's not a probate conservatorship like what Britney Spears had, okay? It's an LPS, a state-controlled conservatorship, and most often somebody in the state is the one that is overseeing the person. Sure. They get an attorney, they get a patient advocate, their rights are protected in the system. But what we're seeing is we don't have enough beds. Most of the psychiatric beds in our state are being taken up by incompetent to stand trial people from the jails who have already been arrested. We have an AOT program, assisted outpatient treatment, that has never functioned correctly in our county. And I know I've blasted this over and over, but AOT, under Laura's law, we've had it for 20 years, and we've only had 10 cases in San Diego County since 2015 of people. It's court-ordered treatment, but it's outpatient before a person gets into the criminal justice system, or when they're coming out, they can get in good counties that have really good programs. I mean, not that our county isn't good, but the way our county is using that program, we could have saved so many lives and so much money and kept people out of homelessness and jailing, but we're not adjudicating that program correctly. And I know this because I just came from a national conference on assisted outpatient treatment. And when it is done right all across the country, man, does it make a difference.
Sure.
So, we've got a lot of things that are not working right here.
Sure. Chris, just last thing on the subject of conservatorships. I mean, Linda mentioned that, you have groups like the ACLU that sort of say, like, look, you can't step in and make somebody get care. And then on the other hand, sort of the argument she's making from sort of a scientific perspective is these people are incapable of making their own decisions. Where do you kind of fall into the spectrum of that?
Yeah, I think we have to be, again, very careful and very intentional about it. And I'll use a couple of easy to kind of understand. They're not meant as labels, but the cannot and the will not. So what I see that's happening is a cannot is somebody that truly has that medical brain condition, right? They cannot, right? That doesn't matter how hard you try, right? They have a medical brain condition, right? They are a cannot, right? What's happening is that there's a lot of will nots out there. And I am, my whole thing is I got trained. I got the best schooling and training in the country from the Department of Defense. They invested over $500,000 in me over 5 years to become a certified substance abuse counselor, right? So I got to go to Johnson Institute, Hazelden, Rutgers University. And so then, I got that training, and I've spent the last 30 years helping people that have progressed in an addiction and a substance use disorder. And what's happening is that if we start seeing those people as cannots, some of them have got to that point where they've used so much meth, that their brains are severely injured, and now they are cannots. But most of them, Steve, they're will nots. You start seeing those people as victims, it's done. It's over. And that's what's happening right now. We're seeing those people as victims. They're not victims, right? They're not. They have a serious substance abuse disorder, but I have spent an entire 3 decades on intervening into that and getting people out of that. These are hardcore guys. I started in the 90s, right, with hardcore street addicts. They can and they will recover with the right intervention. We are not using the right intervention. You got to have the intervention for the ones that Linda's talking about, and it's got to be better, more better, faster. Got to be a lot better. And then you've got to separate and bifurcate, and you've got to intervene in an entirely different way. The state doesn't do that. The NCNES isn't doing it. They're treating them all the same way, and you're growing the problem. And here's just, I know we're going to shift here, but here's what's happening. We are creating third world conditions and really almost like Mad Max movie conditions, right? Where people, human beings have to have connection and community, but guess what's happening? The community and the connection is happening in a very, very unhealthy, deviant way on our streets. And you are getting this deviant kind of community. And if we let that build, we're in a big trouble, right? Because those people, they are connecting, but they're connecting around deviant behavior. And as Linda has mentioned, when the people don't know they're sick, they get worse and worse. They literally decompose, just decompose. I mean, they are getting to a point where there may not be no return. So I'll just stop right there. But I think that we have to be very careful because the more we see people as victims, the more we're going to try to control, manage, and contain them. It's not going to work.
Sure. Linda, in shifting topics, I want to talk to you for a second about long-term care facilities, and specifically in San Diego County, since that's where our listeners are. So what is kind of the current state of psychiatric long-term care facilities in San Diego County? Like, do we have enough? Like, do they provide the right kinds of services? Like, or what are we missing?
Okay, well, I would say we do not have enough. And that is based on, I'm going to look down here at my stats because I can't keep those in my head very well. But we are supposed to have, according to national standards, 50 beds per 100,000 people. In San Diego County, our beds have gone down and down and down. We now have 28.28 beds for 1,000 people. That's half the recommended level. Now we have this plan coming out of our behavioral health system where, as I said, where the metric they want to work towards is a 40% reduction in inpatient beds. These illnesses are always on the continuum of care going to need inpatient treatment. We already have a human logjam of people waiting for beds in ERs, which is not the place for them. And then we also have the incompetent to stand trial people who are waiting for beds in the psychiatric hospitals in our state. So we have a real problem here. We do not have enough beds, and I can say this because I have parents calling me all the time. Why do you think that the hospitals around here treat and street, and I'm talking about the psychiatric hospitals, treat and street people? That's the mantra, treat and street. They're not getting the care they need. They're not getting stabilization, and they're not getting into a nice recovery mode, and then being let out with truly supportive housing, clinical supports, human supports. They're not getting that. And so they are not getting treated correctly. It's a roundabout way of saying I feel we do not have enough inpatient beds, and I'm totally for the idea of putting in more upstream services, which is what the Board of Supervisors has agreed upon, and that is a good goal. But what kind of services? Are we going to have accountability? Are we going to have evidence-based services that actually help people? And that's one thing, too. I don't like this metric of like, oh, here's something we can do, reduce hospital beds by 40%. Why don't we have a metric that says, let's measure our success by the number of people who are now in recovery, the number of people that have been treated and diverted away from jail. We don't have reports that I know of how our vendors are doing in our county, because a lot of this work is done by outside vendors, not by the county. Where are the stats? It took a reporter I work with a really long time to dig out that stat of that we've only had 10 AOT cases since 2015. And Governor Newsom, one thing I will say about Governor Newsom, he and Dr. Galley, our head of HHS in California, they're like, we're sick to death of trying to fix the LPS Act to lower the barriers to allow people to get the care they need. And I was up in Sacramento last December at the testimony between the Judiciary and Health Committee on what we can do to reform the LPS Act. And, one of the people leading it said, after listening to half a day, so what you're saying is no one is steering the ship in our state. And that is what's happening. Nobody is steering the ship in our state. So as far as our county goes, let's work towards metrics that are actually helpful and that actually save lives. And let's include our families. They are not including the family voice. The families are the ones that have gone through this system. They know every nook and cranny. They know what needs to be done, and we're still not getting it done because they're not listening to us. The behavioral health department, I think I'm pretty much in the know because I keep keep my reading up and see what's happening, I don't see any families coming in. I don't see them asking families, what happened in your family? What could we do better? No, they're just all busy about doing their, putting a plan out, making a metric that I find totally not right. I mean, no, reducing beds when we already have a bed reduction. I totally agree with their idea of upstream services. I've been pounding that in over and over. But they have to be the right services. They have to be monitored. They have to have evidence-based data where they're reporting the data so we can see what's working. So I will end it there.
Sure. Chris, any comments on what Linda just said?
Well, I just say, our public is very wise to this. There's all this stuff about evidence-based. Like, I get it, right? Evidence-based. Wow, it sounds great. You look at the evidence-based. Yeah, that looks good, right? It's not working. We're not getting the results. And so as Linda was just talking about, results speak everything, right? Show me the results. What are the outcomes? And we are not getting that. The public is not getting. So we're spending billions, and we're not getting we're not getting any results to speak of. Yet we're told it's all evidence based. So something is wrong with the evidence based. I think the part of the problem is, a big part of the problem is I think the evidence based somehow got us to a point where it is about treating symptoms of the problem instead of the root problem. And people are kind of fascinated with optics, like surface level stuff. So it's like, whoa, marketing plan looks great. Like, I think that'll work, right? The public looks at it, it kind of makes sense. So then we do the optics thing, and that passes legislatively. And now here we are, right? We have reaped what we have sown. And again, it's not, it's very interesting because you got to think that the people making these decisions know what they're doing. Like, do they just not know what they're doing? I don't know. I think they know what they're doing. So what is the intent? Like, intention is everything, right? So I think, Steve, we're in a position here, I think, where San Diego County, we have an opportunity here to turn the tide. If we don't, it's gonna get a lot worse.
Go ahead.
Can I just add to that? So one of the big problems that I see is that the people that are making decisions, the politicians, on diseases like, schizophrenia and all that, they don't understand the disease. They don't understand what's needed to treat the disease and what's going to provide a great outcome, recovery, etc. And the metrics that they are putting forth are not the right ones to try to work towards. So I agree in many ways with Chris that, come on, enough talk, more action. We're treating and treating people, and we're failing and jailing them. Enough is enough. Enough reports, enough, plans without family input. Not just family, but people like Chris who work with these people on the streets, okay? These are medical issues. They are not rights issues. Psychosis is a life-threatening medical condition to be treated. It's not a right to be protected. If I came down with schizophrenia tomorrow, I would want my family to get me into involuntary treatment. I mean, I call it compassionate treatment. In the regular healthcare system, doctors call it life-sustaining treatment. So if you're in the emergency room, you have a stroke, say, you cannot exercise your decision-making capacity at that time. Does the doctor stop and call up an attorney and have somebody come in while you're getting sicker and sicker? No. He just goes in, he or she, and treats the condition. We're not doing that with people with severe brain diseases. We're not doing that. These are neurological diseases. We're not doing that. That isn't right.
Earlier, Chris, you made the comment that there's a big difference between, like, intervention alone isn't enough. You have to have the right kind of intervention. And I wanted to circle back to that comment and talk about this in relationship to the work that you do at Solutions for Change, the specific approach that you guys take to this issue. Like, what does the right intervention look like?
Yeah. It took us a long time to really figure this out. And so we were never afraid or hesitant to experiment with different things. This is human beings bring all different types of problems, causative factors. Nobody's just there's not just one type of person that comes in, and so I think it's a combination of a couple different things. So first off, the people that we help, they've already lost a lot. So many of them have lost their children. They've had very serious losses, like loss of home, loss of job, loss of kids, loss of freedom. They've been locked up. They come to us. So what we do is, all right, let's look at what caused the consequences of homelessness or incarceration. And oftentimes what we find is the root causes are oftentimes trauma related, right? There is trauma there somewhere. And a lot of times it's family of origin stuff. Other times it's a violent situation. Sometimes it is a medical situation where there is a bona fide medical health issue, such as bipolar or depression or schizophrenia or what have you. Oftentimes what happens is the person experiences a lot of very like we all do, man. I mean, we're human beings. It's not easy to be a human being sometimes, right? Stuff happens, right? But as I was mentioning today, the access that human beings have today to escape is incredible. You can swipe right and have sex on Saturday, right? So you got to escape that way. You can get into very bad sexual scenarios. You could, drive a few miles to a casino and gamble. All these things are illegal, but the access to it is incredible. What happens is that if a person continuously escapes, they will experience negative consequences. And so what we look at is, okay, is that occurring? And we find out, yes, it is. It's occurring big time. A lot of times it's the access to drugs and alcohol, and the drugs and alcohol today are a lot stronger than they were just 10 years ago. So we attack it from that position, right? And our interventions then are designed around this. People have to have purpose, and they have to have community. Once you bring people together in a community of like-minded people that are committed and dedicated to getting healthy, then you can lift them up and they will begin thriving. Once they begin thriving, then they begin believing that, this thing called life is actually kind of fun. Like, I don't have to have all this escapism stuff. I can work. And then the work part of it is also significant. A lot of people that we help, they've been out of the workforce for a while, or they've had multiple jobs. So we introduce a whole entire workforce training regime that just helps them get back in the workforce. And we very good at that. I mean, that's kind of where our specialty is, if you will. But it's the whole package of the health and the work together within a therapeutic kind of community. And that's the intervention that I believe is needed. And honestly, we've been able to help quite a few people that also have bona fide mental health disorders, in addition to substance use disorders, and they thrive too. Why? All of a sudden they're in a community where it's supportive and they feel like I can talk about stuff, I can get the support. We don't have enough of this, Steve, in our community. Why is that? Because the state said the solution, based on our evidence, is get them behind a door. Well, what happens after you get them behind a door? One of the saddest things is, and I'll just share, there's a very large nonprofit in San Diego County where we used to see a bunch of people in their courtyards. If I name the one, everybody would know it. And there was laughter and there was connectedness. And when I went down there with the CEO not too long ago, he said, "Chris, remember when everybody was down here in the courtyards and it was cool, it was nice?" He goes, and I looked at it, I was like, "Yeah, what happened?" He goes, "They're all behind doors now, and nobody is coming out and being part of the community because the entire system has all changed to get behind a door, and there is no promotion or encouragement of these kind of things anymore." So you get behind a door, and he just looked at me and kind of a tear in his eye, and he said, "We know they're dying back there," and they do. And horrible. It's sad, man, because again, it's legislation, it's top-down stuff. So I hope that answers your question,
Yeah,
Steve.
absolutely. Lynn, I want to turn to you and give you the opportunity to talk about some of the work that your organizations do, and in particular on the mental health front, some of the advocacy work that you've been doing.
My organization works to help people that are suffering from schizophrenia and psychosis disorders, help them get the treatment they need and deserve, help them get new treatments. We do a lot of work with organizations that are developing new sorts of treatments and new ways to determine upfront, like new diagnostics, I'm trying to say. And we also really work to make the public aware that these are neurological conditions and that they are treatable conditions, and these people deserve the treatment to live and thrive. So we kind of approach it on all different fronts, and we just want people to get equitable treatment in our healthcare system. So I joined this organization because I come from a family that if you see something that is so egregiously wrong, where people are being hurt, you don't just sit there and do nothing. You stand up and you work to make it better. So that's kind of how I got into advocacy, and I have a family member who also suffers from this, lives with this type of illness, and so I know what I'm talking about, and especially with our county. And I help people every day that call me that are trying to get their kids basic health care in our county. These are folks that, they have tried everything. They've called the conservatorship office. They've called the PERT team. They've called the MCRT team, the new teams now that are supposed to come out and be better than a straight police interaction, but those teams often will not even take people. I've had moms calling me saying, my son is just in terrible psychosis. He's deteriorating. He lives in the apartment with me. They came out and said they could do nothing. Well, why can they do nothing? Because of our laws. Because you have to be a danger to yourself or others, or gravely disabled. I'm getting a little off topic here with my work, but at the community level, these are my points. So just think of that. If I had cardiac disease and I had to meet a dangerousness criteria to get the medical help I needed, just think about the different definitions of gravely disabled in our own community. It's just horrendous. Where I was told by a county official that if your loved one was laying on the street with sores all over their body, obviously very ill, if they could pull themselves up to the trash can rim, stick their hand in and eat a piece of garbage, they're not gravely disabled. That definition needs to be changed in our state.
Yeah, that's wrong.
And we need to really take a look at that. And I know that Senator Susan Eggman has been trying to work very hard to make really positive changes around the LPS Act. And so those are the kinds of things, and this anosognosia is a big part of our organization, bringing that awareness to the public. And I hate to say this, but bringing it to the medical professionals who are supposed to be the ones treating people with these brain diseases, and they don't even know about anosognosia, or they think it's denial. That's pretty scary. Mm-hmm. And then you've got folks and many of the folks that are on the streets that you see, they had families that loved them and cared for them and tried to get them help. But at a certain point, they had to let it go. They had other kids. They had to work for a living. They had to let it go because they couldn't get the treatment. And, that's very, very sad. And they end up. So my organization is really all built around making what these diseases are known, letting the public know what they are, because we all know that to make cultural change, it takes a long time. People have been seeing awful movies, horrible depictions of people with schizophrenia that are not true. I mean, it's very, very sad. The majority of people that have schizophrenia they're not murderers. This is horrible. It's discrimination. It's systemic discrimination. And we want the public to really understand what these are and that they're treatable illnesses, and that our society is not allowing families to get their kids or other adults into treatment. That is wrong.
Sure.
So anyway, that's...
I want to end our time today with more of a positive note, because we've talked about a lot of what's wrong in the system, what's not working. But as Chris, you kind of sort of alluded to, like there are real organizations making real impacts in our county. There are people whose lives are being transformed, whether it's through Solutions for Change or whether it's through Linda's group. And I want to just share a couple stories or examples. Like, Chris, can you talk to us about a time where you saw someone's story turn out for the better?
Yeah, I mean, so many. So I'm going to share the story of Tina. She's walking down what used to be called Hill Street in Oceanside, so Pacific Coast Highway, and about 14 years ago with her 4 children, done, ready to give up. She was addicted to meth. She had tried various different things. It was with her kids, literally homeless on the street, lived down at the beach, walking down the street. And today, after graduating Solutions for Change about 11 years ago, she is the property manager for our new apartment complex that is 3 blocks from the beach. It's called North Coast Terrace, and she lives now in the upper unit with an ocean view. And all 4 of her kids are college graduates, which is amazing. Like, literally incredible story of just what she had to do to make a difference, to make a move in her life. And she was done. She was ready to give up. She was just like, I got to give my kids away. I'm going to give them, whether the system takes them or somebody I can't do this anymore. She was right there ready to give up. And our outreach team literally walked right into her. And, all those years ago, and she said, I'll do whatever you want. And today she is she's very skilled in property management and running one of our places right there in Oceanside. It's just a few blocks away from where, we got her. So just one of many stories. And of course, that we help families, so many. And, the thing is with that is you get to that mom or that dad, or mom and dad, and you are talking about generational transformation, because all of those kids were headed to someplace not good, and now all of them, right? I mean, it's just so I was shocked when her last kid in college is like, wow, so all of them, right? Pretty amazing to see where they could have been and then where they're at today.
Sure. Linda, what about you? What's a success story you think you could share, like a time where you saw somebody who was homeless, somebody who was dealing with some of these conditions, and happy ending?
Well, most of these people, it takes 10 years to get a diagnosis. So you can imagine the brain damage that's happening to that person. So I will say that I have seen a couple cases of really miraculous recovery. One is with a person that started getting ill in college. And that often happens because these schizophrenia in particular and other brain diseases, bipolar, schizoaffective, major depressive disorder, they start usually between 15 and 25, and they hit a lot of kids that are in college. And, they don't know what's happening to them. And so this particular case, the kid was in college, started getting sick. The parents were thousands of miles away. They didn't know anything about what was happening because the college didn't inform them of anything. And the person had a breakdown. And then it took 8 years for the family to get the person into care. And those years were untreated, and they involved jail time. They involved homelessness. I mean, it was horrendous. And then finally, when diversion was offered, the person got to go to an incredible residential treatment facility in our county.
In San Diego County.
San Diego County. And they had about a year and a half there in treatment, getting on the right meds, having people around them who cared about them. And today, that person is in grad school, and they are getting a master's degree, and they are in recovery. So I just want to end on a positive note, that recovery is so possible. Hope is possible We need to make it happen. Everyone that's listening or watching this, you can help. We need to make this happen. Our government is putting up, barriers in many ways, and they don't really understand these illnesses, and they don't understand addiction real well, in conjunction. And a lot of people with serious brain diseases, they have co-occurring disorders with addiction. So I'm just saying it takes more than a village to make changes. I mean, we're not all politicians. Politicians often do not get it. And again, I want to call out Governor Newsom. I think this is a positive thing. I mean, I'm not sure, the devil's in the details, but this care court concept, this is different than AOT because it is adjudicated at the state level, and every county in our state, all 58, have to do these programs, to try to help people. So he said when he rolled it out that he was working in the margins of the LPS Act, because we've tried to amend that act so many times over the 55 years, and the ACLU and disabilities rights groups always intervene and put the nix on it. So I will say I'm anxious to see what will happen here. I hope it's not going to be another dead end, but I have hope for it to get more people that need treatment into treatment.
Sure. And just some closing remarks. I just wanted to say, Linda, you brought up this story of this college graduate who, did deal with a mental illness, who now is in recovery. And I think it's interesting to note that, we had a conversation before this episode where we talked about the stigma that goes along with a lot of these brain conditions, the stigma, that makes people even hesitant to share the names of, those who they know in their own lives who have experienced these kinds of mental conditions, who've experienced homelessness. And I think that a part of this conversation has to involve, how do we change that attitude? How do we change that mindset? So just a sort of closing remark. But
I would like to say that stigma is a huge part. Now, you have a population that cannot advocate for their own care, so their families are actually being caretakers and advocates and doing everything that a social worker really should do, and a doctor, and that's being put on them by our society and our policies. And the thing is, if a person starts getting into recovery and then they go out, if they start doing any kind of work or telling their story, they can get fired from their jobs. If they get a job, they can get fired because there's so much prejudice and so much misinformation around these illnesses. I don't really think the public understands that all these illnesses can be treated, and the majority that are treated, the people are working and they have an independent life. They're giving back to society. They have a happy life. Whatever that a life looks like to them, it's rewarding. And, I want the public to know that, because this is a point that we're going to have to address in our culture. We need to change our culture in how it views these illnesses.
Yeah. Chris, any closing remarks?
Just that, what you see is what you do is what you get. So if you see people as victims, if they can't do it, then you're going to control, contain, and try to manage them. And what you get is a lot more dependency and a lot more suffering. But if you see people as victors, then you invest in them, you grow them, and you lift them up. You're going to get people that are thriving back in our community. And I think a lot of this is how we collectively as a society see this. We can change it. We don't need the government to tell us how people should help each other. This is our community. Encinitas is ours, right? We're the people that are here. The people of this community can help the people that need the help versus being told how we should do it or what we should do. I think we can do it. I think we're a compassionate enough person, but it has to come through that lens, I believe. And so thank you, Steve, for having us here today.
Thanks for coming on. Again, Chris Megison's the president, CEO, and co-founder of Solutions for Change, nonprofit dedicated to ending homelessness. And then, again, Linda, thanks so much for coming on. Linda's the vice chair of the Schizophrenia and Psychosis Action Alliance. I've just really enjoyed interviewing you over the last few months, and I hope we can bring you both back on the podcast. So thanks so much, guys.
Thank you so much, Steve, for the opportunity to speak out.
Yes, absolutely.
This has been another episode of Stay Classy San Diego with your host, Steve Wire. Thanks again to our sponsors, MaxLux Media at maxluxmedia.com and Barntime Productions at barntimemusic.com. And thanks to all of our listeners for tuning in and viewing the show. We'll see you next time. Stay classy, San Diego.